Welcome to our talk on taking it to the streets. It's about how we've scaled engagement in the state of Georgia for child welfare, foster care, and pediatric autism. I'm Bob Gold, and my background is in the science of human motivation, activation, resiliency. It involves cognition and behaviors. And my co-presenter is Danielle Nabinger.
Hi, my name is Danielle Nabinger, and my background's in child welfare and foster care. And I'm pleased to join Bob here today to talk about this important topic.
Great. Thanks, Danielle. Uh, so, what we're going to take you through is something that every state managed care organization, hospital, or other nonprofit could do today. So, it's not about trying to revamp the whole system, it's not about a long term change of policy, but it is about applying a brain science and engagement technology that has proven to change lives, outlooks, believability and trajectory, and has even saved lives. So to get everyone interested in what we're about to say, let me just show you the outcomes at the start. So 6 times improvement in safety of living environment. That's a huge factor for those of you familiar with child welfare, foster care, juvenile justice, and autism. 350% increase in feelings of belongingness. Big factor with all the trauma and stress that goes on. Clearly, family preservation, reunification is important, so a tremendous improvement there. This one actually has more of an impact than most people realize. We've gotten a lot of people back to full-time employment, and that raises their believability of themselves, their self-care, their outlook, and that helps a lot. Significant improvement in their ability to handle daily problems. And for those who are experiencing substance use and addictive behaviors, we've really had very little rearrest or relapses. So it's been wonderful for the human beings involved about changing lives.
There's almost no child welfare problem that can't get better or be improved if we more closely engage with the children and families that we are attempting to serve and support. Things like keeping families together, preventing entry into foster care, transitions in care, placement stability, permanency, you name it, engagement helps each of these issues.
Yeah, it's interesting. A feeling of disassociation and abandonment is a result of a lot of this not happening. So let's explore why it doesn't happen with Danielle.
Yeah, there's a lot of reasons why we don't engage more with the families that we are attempting to serve and support. The primary one is it's really hard. It's very time consuming. It's hard to scale at any significant rate when you have hundreds, thousands of families that you're trying to support. Um, it's hard to know what to say and how to engage consistently across a large workforce that is constantly turning over and difficult to retain and train consistently. These conversations can be hard conversations to have. It's hard to reach people when they're in their immediate need. It's really difficult to individualize to the different needs of children and families. And again, it's hard to connect and follow up and track the resources and supports that these families need. So engagement is really difficult.
Yeah, and shortly we're going to show you how we've dramatically increased engagement that has had wonderful outcomes. For example, the ones I've showed you. But Danielle, one interesting item is another thing that makes it hard is there's a huge turnover in staff among child welfare, foster care workers. So that also makes it very hard. I think the average tenure is about 2 years, right?
Yes, absolutely. Turnover is is a huge issue in trying to support these families.
And yeah, and in all of our lives, you're going to see in all of our lives, what do we look for? Some consistency, some routine, some people that are there for us, that know us and learn about us, and we could express things and they respond. And it's hard when there's a revolving door of folks who's someone going through child welfare, foster care. Uh, and also, if you have a child that has developmental challenges such as autism, how could we help families and children through that?
So we talked earlier about the fact that, engagement can be really hard, but the vision would be, what if we could make engagement easier? What if we could, like Bob mentioned, scale from serving 100 people to 1 million people? He mentioned the Georgia program, autism program, where we're currently serving 132,000 caregivers and their children. What if we could do that? And we can. What if we could customize it to be individualized to the needs? And we are. What if we could have messages that were based in behavioral science, that provided closed loop referrals, that allowed for escalations to needed resources and people who needed to be connected to the family throughout the whole system of care? What if we could, capture all the data related to all of these interactions, and collect the opinions and perspectives of the people being served as well as the service providers? And that's the great opportunity in this program to create um, easier, more fluid engagement to achieve some of the outcomes that we've talked about.
Yeah, and to Danielle's point, we're collecting 50 to 100 life factor data points longitudinally that have never been collected ever, either in Medicaid, child welfare, foster care, juvenile justice, or pediatric autism. So just imagine how that can help in so many areas of what we do. And that can relate back longer term to policy and protocols and therapies. And so we talked about the science. Now let's show you how GoMo acts as a child welfare worker virtual assistant.
We're going to walk through a case example of a mother and her daughter, and her family really, who has been part of the GoMo Georgia Autism program. And so Mary was adopted Lily right after Lily's third birthday. Around age 4, Lily began demonstrating some difficult behaviors. She was withdrawn from peers at school. She had difficulty communicating and sudden outbursts. Um, at 5, Lily was diagnosed with autism spectrum disorder. Mary is a single mother to 3 other children and has been under a lot of stress, especially since learning about Lily's diagnosis. Um, it's resulted in Mary having some really significant doubts about her ability to parent Lily. And she's questioning whether or not she can continue to provide the best home for Lily. She started to engage into the GoMo program, which you can see here is really simple. That she begins getting messages directly to her phone to begin the engagement and begin to learn about Lily's needs and her family's needs.
Yeah, it's interesting. Um, the Mary, the parent, how do you know how to deal with something you've never experienced? And you, somebody with an intellectual issue. And also, how do you do that with your own stress? It's similar to, hey, I became a type 2 diabetic today. How do I practice? What do I need to do to get better? So in this particular case, we ask a lot of questions and she's filling out a little survey and we're helping her navigate, what do you even do at school? The program helps them with the IEP and things to do. And then based on the quick little survey, and it asked a lot of questions about what's her confidence level, she can get through this, what's her stress level. So we help both parent and child. We help the parent, Mary, with her own stress and coping, because if a mom or parent feels better about themselves and they can get through it, there's less stress all around. It definitely reflects on the child and the environment and what happens with them.
So the story continues where, Lily is assigned to a care manager, Jolene, who receives an email after Mary completes the survey and learns that Mary is under significant stress. This built-in escalation allows the folks who are trying to care and support Lily and Mary to know that there's an issue. It kind of allows them to monitor what's going on with the children and families on their caseloads across the programs that are serving them.
It really helps bring joy and practice to that care manager because of all the cases, they're theoretically only supposed to have X number of cases. That doesn't exist. People are overwhelmed. There's too many cases and they can't be with people. So how did they know Mary needed help right now? She was under stress. And that's the engagement that GoMo's providing in this virtual assistant. So it's really not only helping Mary and Lily, it's helping the case manager actually feel good and have high impact and do the things that Mary needs in the moment before they escalate into an adverse event. And then all this information is stored in this learning content management system. And actually, based on what Mary's issues are, those things rise to the top. It's fascinating. So Mary's seeing what she needs in the moment, what her preferences are. She could refer to it. And so is the case manager. It's not just a general portal or app. It's a web-based technology that individualizes what people need to see based on what they're going through in the moment.
Through the support she receives through the program, Mary is feeling much better and is very well supported in caring for Lily's needs. And this has resulted in Mary's stress and anxiety being reduced so that she can feel comfortable continuing to care for Lily. She has access to resources both for her daughter and for herself to know how to increase her capacity to appropriately parent and support Lily throughout her childhood and beyond, actually.
Yeah, and to Danielle's point, and what we all need is a little help from a friend and getting it to the right people at the right place, not just calling an 800 number and being transferred or going to some portal with a million different options. So basically, there's built-in escalations in the virtual welfare assistant. So if a member, we ask a lot of questions, if a member indicates any of these things, even access to transportation, it actually escalates in a closed group referral way to the right resource that can help Mary and Lily. Danielle talked about what about if engagement could be easier? What about if it could do closed loop referrals and escalations? Well, here they are. And these can be customized based on the circumstances, but they've proven invaluable, and they've actually proven in many cases to save lives, save adverse events, save people from harming themselves and their children. 9,600 members enrolled in the early intervention autism program, specifically children with autism. We have practically 98% of all children on Medicaid with autism in the program, with a 94% retention rate. This is after 2 years. And overall, helping families with young children for early intervention, detection, and other issues, developmental issues. We have 121,000 members of the program at 93% retention after 2 years. So as you can see, it's staying with people. And in the story of Mary and Lily, it will stay with Mary and Lily for 10 years. Imagine that. So they'll have like a knowledgeable friend, concerned sort of expert in the virtual assistant walking around with them. And we've received 7,700 escalations that have reduced ED visits, reduced panic, reduced really what could be horrific human and financial toll on people. And we asked a lot of questions, received 50,000 bidirectional responses that actually the virtual assistant was able to help them through that. The 7,000 was where, hey, it really required human intervention, which we did in a closed loop referral. There were 50,000 questions that the system itself was able to answer and solve for the person in the moment. That's why Mary and Lily were able to stay together, as an example, because of what you see here and how the system works. So in the end, this is all about engagement that works, and it's about applying a form of technology, cognitive and behavior modification technology. It's not just general technology that acts as a personal virtual child welfare assistant that can really help people. And it does so because cognitively, over time, people don't differentiate something that's very helpful and personalized to them, whether it's coming from this virtual assistant or another human. And there's about 40% more honesty and transparency that really, again, we escalate, could help the human care coordinator. So it's proven to act like a good friend and healthcare professional all in one to folks. And that's why it has such outcomes. And that's why we're able to scale, as Danielle said, up to millions of people. So on behalf of Danielle and I, I'd like to thank you for listening.